speech number 2, informative speech, and today I'm going to be telling you guys about the proper puncture technique. I'm actually training to be a phlebotomist right now. I do this every day at clinicals, and there's several reasons why phlebotomists need to be trained at the proper technique to make sure that they're doing the job correctly. We need accurate blood samples because there are so many diseases and infections that are in circulation today. That way, they usually diagnose these diseases and infections by blood sample. And you need to make sure that you are protecting your patient's privacy. That's a big issue today. And also, you need to be practicing universal precautions to minimize the spread of infections. Now, today I have my patient here, and I'm going to be performing a puncture on her. Now, first off, you're going to get your test requisition. You're going to review it and see how much blood you need to obtain, what kind of test you're going to run, and you're going to knock on the door and identify yourself. Hi, my name is Jess. I'm here to draw some blood from you today. And you need to get their consent. That's very important. And you need to identify your patient. Are you Melissa Martino?
Yes.
Can I have your date of birth?
September 21, 67.
Okay. Now you also need to verify diet restrictions or latex sensitivity. That's very important because if they're supposed to be fasting, that could mess up with the test if they didn't follow the directions. Next, you need to gather your supplies, sanitize your hands, and get your tourniquet, and find a vein. Maybe this one, man. Try this one. Now, also, while you are looking for the vein, you need to talk to the patient. You know, that's professionalism. That way, you're making them feel comfortable, and they're, you know, that earns them your trust. Get your supplies ready, and make sure that you keep an eye on your patient through the procedure, because sometimes, you know, they could get sick or pale, nauseous, anything like that, and it's very easy to forget that the arm you're working on is actually connected to the person. After you populate the vein, can you hold it for me, ma'am? You take off the top. You need to make sure the needle is up, the bevel is up.
Is it gonna fall on something? Is blood gonna go anywhere?
Alright, now then you anchor the vein, you pull down. This helps hold the skin tight, and the needle doesn't hurt as much when you stick it in. You're going to feel a poke. And you insert the tube. And there's a vacuum on these tubes that it will automatically stop whenever it collects enough blood.
You're at 4 minutes.
You release the tourniquet. And you take the tube out with a push and pull method, which keeps the needle, prevents the needle from moving around and hurting the patient. Make sure you activate the safety device as soon as possible. And you apply pressure. And you want to mix the additive in the tube. You label as soon as possible and follow all the guidelines to bring it to the lab. That way, some of them you have to shield from light or keep on ice. But you would bandage the patient, thank them for their time, and that's the proper puncture technique.